My name is Father Charles Chilufya. I am a Jesuit priest and I work for the Jesuit Conference of Africa and Madagascar. My role in the Jesuit Conference of Africa and Madagascar is the coordination of the Justice and Ecology Office of the conference, which is concerned about various matters of social justice and ecology within Africa. And I try to provide synergy and coordination among the various Jesuit efforts in Africa in the social justice and ecology fields. One of the social justice issues that my office engages is a question of health justice, which is about access of people in Africa to quality health care. Do they have medicines? Do they have people to attend to them at hospital? Can they go to hospital? Can they afford quality and effective medicines? And those medicines that should be affordable. And that is where we find a problem, that not everyone in Africa, in fact the majority, don't have access to quality health care. And this has been accentuated especially in the wake of COVID-19. Not only did people lack access to vaccines against COVID-19, but several other forms of medication or care that should support them in receiving quality health that they need. That is why we have mooted an initiative called Africa Health and Economic Transformation Initiative. It is an initiative that brings various players who are concerned about health justice, which is bringing together various actors in the field of health or who are concerned about health issues, majorly governments, health experts, the private sector, and various individuals and groups who want to make a difference in regard to or to ensure that everyone in Africa has access to quality health care. The World Health Organization has defined access to quality health care as a human right. It is inalienable. That means every person should have access to health care without discrimination, whether by reason of social differences or economic status. This is an ethical imperative, because if people do not have access to health care, that is an affront to life, that is a threat to life. And we should stand then together to ensure that nobody loses their life needlessly, that we should protect all life at whatever cost. Aheti's vision is an Africa free of disease. And how do we hope to achieve that vision? We have realized in the wake of COVID-19 that Africa needs to rise, and respond to the difficulties that I have highlighted. Those blocks, those issues and systems that block Africans from having access to quality health care. And specifically, Aheti is beginning by focusing on the eradication of the endemic poverty diseases in Africa, namely malaria, tuberculosis, diarrhea, hepatitis B, HIV and AIDS, and similar ailments that have plagued Africa for a long time. And we're going to do this via 4 initiatives. First of all, we realize that we don't have sufficient data that should help us make informed decisions in regard to how we respond. So we are going to establish a database of what does the disease burden in Africa look like. What are the issues? So that in that regard we respond accurately and with precision. And going beyond that, we have a plan to establish biomedical research centers that are going to undertake research that will pay attention to the genetic diversity in Africa, what the diseases in Africa look like, what does the Africa human body or human bodies look like, and how can we create solutions that are Africa focused, that can ensure in the end that diseases are eradicated in Africa. As we speak now, most of what we need is sourced from outside, and we would like to change this. So we are already working with experts who have already come on board. Africans, some of them who have come from the diaspora or they are still in the diaspora. But beyond Africans, even other individuals of goodwill and groups from outside Africa who are working for Africa and together with us are coming together to establish these institutions so that we create an opportunity to engage what is termed as precision medicine, responding to issues and to difficulties and diseases in Africa with African solutions. Ubuntu is a very powerful African word which talks about humanity, being human, having concern, care, and compassion. And we need that in the healthcare. When we speak about ramping up pharmaceutical production and innovation in Africa, we recognize that beyond self-interest, human beings are also moved by care and compassion. We know that there are businessmen and women out there, experts, who are concerned about the situation in Africa with compassion, and they care and they want to make a difference. And we set up this fund as a reward toward those people so that as they impact Africa in that way, reduce the disease burden, we support them with financing in reward to their concern, compassion, and their impact and dent on diseases in Africa. This differentiates from the current TRIPS model that is motivated or motivates producers and innovators toward profit. Profit is not the only thing. Markets cannot solve our problems alone. We need something of humanity, something of Ubuntu, concern and care in order to resolve these problems. This fund is also a trust fund, which means that Aheti is going to hold it in trust on behalf of various other human beings who may not be scientists, individuals, governments, philanthropists, and several other groups, private sector, who will contribute to this fund, okay, which will be held in trust by Aheti. And that can be guaranteed because Aheti has established a very robust secretariat and a very competent board. There are already Africans living in the diaspora and inside Africa, as well as other men and women of goodwill who have already come on board. And these are experts who can't function by themselves. So what Aheti is doing is that it is matching such competence with already existing resources. For example, we being a Catholic-led institution, we are tapping into the vast array of a large network, okay, of hospitals, faith-based hospitals, as well as national hospitals, referral hospitals, to work together with these experts so that together we can defeat disease. And this is where Aheti comes in. The role we are playing is to mobilize all of these resources and bring them together, combine them in such a very harmonious way and impactful way that we can resolve the difficulties that we are facing. I am talking about the vast array of, for example, ourselves, we are a church-based institution. I'm talking about the vast array of a network of Catholic hospitals, Catholic experts, and several others of other faiths and non-faiths that we are working with. I can give you an example. In Kenya alone, where we are here, the Catholic Church Network was able to deploy the resources of 80 to 100 hospitals when we were under difficulties of COVID-19. And those institutions still exist, plus other private sector hospitals that are thinking along these lines, and several other individuals. So we bring all of these resources for greater impact. Aheti is about transformation of healthcare systems It's about transformation of economic systems, economic rules and laws, because they affect us. The way they are designed, they will determine whether you have health care or not. So we are working together with others to transform these institutions, economic and social institutions. But not only a transformation of economic and social institutions, but also a transformation of hearts and minds toward the search for the common good. But in order to undertake this kind of transformation, you need good leadership, both at the technocratic level as well as the political level. And what is Aheti doing about this? Aheti has mobilized a group of experts who have developed programs for leadership development targeted at political leaders like ministers or people of the sort, as well as technocratic leaders, so that when they engage these issues, they engage them with the competence that is needed. We need that kind of transformation. We need transformational leadership, and Aheti is going to provide that through this very rigorous, robust program for leadership development. This concerns every one of us because we all care. We will all need to be involved. I am inviting everyone, governments of Africa, private sector, philanthropists, several other individuals in Africa to come on board and be part of this initiative and support it. Please join us in this noble effort and movement to eradicate disease in Africa, to promote social justice for all, and to preserve life.